Before taking Zolmitriptan Odt, make sure to read the Patient Information Leaflet from your pharmacist. When you feel the first sign of a migraine, place the tablet on your tongue and let it dissolve, then swallow it with saliva. Do not take it with water or other liquids. It's important not to break or crush the tablets, and to keep them in the original packaging until you're ready to take your dose. If your symptoms don't improve, don't take more without talking to your doctor. If your symptoms are only partly relieved, you may take another dose at least 2 hours after the first one, but do not take more than 10 milligrams in a 24-hour period. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Make sure to tell your doctor about all the products you use. If you are at a higher risk for heart problems, your doctor may perform a heart exam before you start taking Zolmitriptan. They may also have you take your first dose in the office to monitor for serious side effects. If you are using drugs for migraine attacks on 10 or more days each month, it may actually make your headaches worse. Do not use medications more often or for longer than directed. Talk to your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Some common side effects of Zolmitriptan Odt include tingling/numbness, nausea, dry mouth, weakness, drowsiness, or dizziness. If any of these effects persist or worsen, please consult your doctor or pharmacist. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Zolmitriptan Odt may also raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. If you experience any serious side effects such as blue fingers/toes/nails, cold hands/feet, chest/jaw/neck tightness, pain, or pressure that is not typical for you, it's important to seek medical attention immediately. Additionally, this medication may rarely cause a serious condition called serotonin syndrome/toxicity, especially if you are taking other drugs that increase serotonin. If you notice symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness, seek medical help right away. In rare cases, a serious allergic reaction to this drug may occur. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek immediate medical attention. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Zolmitriptan, make sure to inform your doctor or pharmacist about any allergies you may have. It's important to discuss your medical history with your doctor, especially if you have any circulation problems, certain types of headaches, heart issues, liver disease, seizures, or a history of stroke. Be aware that certain conditions such as high blood pressure, high cholesterol, diabetes, a family history of heart disease, being overweight, smoking, being postmenopausal, for women, or being over the age of 40, for men, can increase your risk of heart problems. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. Also, limit your alcohol consumption and talk to your doctor if you use marijuana. If you have phenylketonuria, PKU, or any condition that requires you to avoid aspartame, be sure to talk to your doctor or pharmacist before taking this medication, as it may contain aspartame. Before undergoing surgery, inform your doctor or dentist about all the medications and products you are using. For older adults, the risk of heart disease, liver disease, and high blood pressure increases with age. They may also be more sensitive to the side effects of this medication, especially an increase in blood pressure and heart problems. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding. It's important to be aware of potential drug interactions when taking Zolmitriptan Odt. MAO inhibitors should not be taken with this medication, as it may cause a serious, possibly fatal, drug interaction. It's also important to avoid other drugs that increase serotonin, such as certain antidepressants and street drugs like MDMA. If you take any ergotamine medication or other triptan drugs, be sure to separate your doses to reduce the risk of serious side effects. Always consult your doctor before making any changes to your medication regimen. If someone has taken too much Zolmitriptan Odt and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to remember not to share this medication with others. Certain foods, beverages, or food additives like red wine, cheese, chocolate, and monosodium glutamate, as well as lifestyle patterns such as irregular eating or sleeping habits and stress, may bring on a migraine headache. Avoiding these triggers may help lessen migraine attacks. Your doctor may recommend lab and/or medical tests, such as monitoring your blood pressure, while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. This section is not applicable as it pertains to the How to Use section in the original article. It's important to store Zolmitriptan Odt at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When you no longer need the medication or it has expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.